Welcome to the first lecture. We hope you find this information helpful and interesting. The following lecture pertains to the nutritional assessment of patients with head and neck cancer. Upon successful completion of this module, the student should be able to complete the following learning objectives. Learning Objective 1, assess patients with head and neck cancer for malnutrition using appropriate tools. 1A, prioritize nutrition problems based on assessment data. Learning Objective 2, plan the appropriate nutrition intervention for patients with head and neck cancer. 2A, evaluate the indications for enteral nutrition in head and neck cancer patients and when to initiate. 2B, discuss the use of supplements and their evidence-based findings for head and neck cancer patients. Head and neck cancers are malignancies that develop in the sinus, oral, and nasal cavities, lips, salivary glands, tonsils, paranasal sinuses, pharynx, and larynx. The nutrition assessment is one of the most vital components of the nutrition care process for head and neck cancer patients. The most important components to document under food and nutrition related history is their overall intake of food and fluids. This includes any enteral nutrition they may be supplementing with. Weight is the most important anthropometric to document, and more importantly, weight change over time. These patients often have a decrease in oral intake, and weight loss can be an indicator of poor prognosis. Be sure to monitor weight over the duration of the patient's treatment. The most important lab results to monitor are hemoglobin A1C and glucose. This is specifically for the patient receiving chemotherapy. Chemotherapy can cause changes in blood glucose, and we want to be sure that we are carefully monitoring levels to prevent hyper or hypoglycemia. It is also important to view endoscopy results in order to assess the patient's swallowing capabilities, especially if the patient is NPO and trying to move to PO. The nutrition-focused physical findings are extremely important in assessment of the cancer patient. The most important components of the NFPF are lean body mass, skin assessment, and assessment of the oral cavity. A loss of lean body mass indicates decreased oral intake and can lead to wasting and cachexia if the patient hasn't already reached that point. Skin assessment can determine hydration status, skin integrity, and wound healing. Oral cavity health is most important in patients who cannot swallow and have cancers of the mouth. It is also important in transitioning the patient from NPO to PO. In the assessment of client history, one of the most important components is indicating any nutrition impact symptoms, such as dysgeusia, dysphagia, anorexia, early satiety, mucositis, xerostoma, or adenophagia. These will provide an insight into how to feed the patient and how to develop their nutrition plan. Comorbid conditions, previous medical history, and socioeconomic status should also be noted. Malnutrition screening is probably the most important component of nutritional assessment for all cancer patients, but especially head and neck cancer. Malnutrition screening should be done when completing the first patient assessment in order for it to be beneficial to the patient and to improve outcomes. Benefits of malnutrition screening include preventing further nutrition depletion and malnutrition-induced complications in those patients who have difficulty swallowing, have decreased their oral intake, or those who will receive radiation or surgery. Other benefits include decreasing morbidity and mortality, protecting the quality of life of the patient and the patient's family, and identifying those patients who would benefit from nutrition intervention by the oncology RDN. Malnutrition screening tools should be able to detect a measurable adverse effect on body composition and function or clinical outcome. The Academy's Evidence Analysis Library suggests using the MST, MUST, MSTC, and PGSGA for screening cancer patients. You will find these resources in the assessment toolbox. The following is an example case study for you to evaluate. This patient has been diagnosed with a head and neck cancer and should be assessed by the oncology RDN. Pause and ask yourself, as an RDN, what would be the most important questions to ask this patient in order to find out if they are at risk for malnutrition? Listed below are examples of questions that you may ask the patient on the previous slide. The most important questions regarding the head and neck cancer patient are those regarding their oral intake and weight loss over time. Please continue to the next lecture about head and neck cancer nutrition intervention.